Assalamu alaikum guys, this is Dr. Faraz Ahmad, and from this video we are going to start a new series in which we will discuss about the PLAB 2 stations and everything, how to proceed with the station of the PLAB 2. Everyone who is doing PLAB 2 must be knowing that PLAB 2 station consists of history, management and IPS. So in today's video we are going to discuss about the history taking. So everyone knows that there are 16 stations in PLAB 2 exam, and every station is marked on the basis of history, on the basis of management and on the basis of the IPS skills. Okay, so you must be knowing that either if it is a medicine station, either you are dealing with counseling station, either you are dealing with ethics station, you are dealing with prescription station, SIMMAN station, breaking bad news station, problem colleague station, there are 4 marks of the history. So in this video we will talk about the history taking of the medicine station. We will discuss about the history taking in counseling station, history taking in the test result station, history taking in the ethics station, and history taking in the breaking bad news station. So today's video is all about the medicine station history taking. So let's proceed. So you have to keep 2 things in your mind. Number 1 is the Socrates and the second one is the Odipara. If there is any pain, like pain in the chest, pain in the tummy, pain in the legs, pain in the urination, and if there is any headache, any pain in the eyes, any pain in the ears, you have to start your history with the Socrates. If there is anything else apart from the pain, you have to ask the question as per the Odipara. So now we will discuss about, like, some patient has presented to you with a chest pain or the tummy pain. So how you will go and how you will proceed. So first of all, you will go there and you will not say, please tell me what happened to you. Who are you? First of all, you have to introduce yourself. First of all, I will introduce myself so that the patient could be in comfort that this is a doctor and I have to told everything to my doctor. So first of all, I have to introduce myself and then I have to check the identity of my patient. So how I will introduce myself? I will say, hello, this is Dr. Ahmad, one of the doctor working at this emergency department. Could you please confirm your full name and age for me? Okay, so this is one way to start the conversation. You have introduced yourself and you have checked the identity of the patient. Most of the people follow this approach. The other way, you will read the patient name and age from the scenario out of your room. So you can enter the room and you can start your conversation like, hello, you must be Mr. James. Patient will say, yes doctor. Then you will say, this is Dr. Ahmad, I am one of the doctor working at this emergency department. So before we proceed further, could you please confirm your age for me? Because you have confirmed the name of the patient in the start, and now you will say, could you please confirm your age for me? Patient will tell you the age, and now you will start the conversation. So you should start the history taking with an open-ended question. So how you will start the history taking? Please never ever ask this question, because this is written in the GMC guidelines that please don't ask how can I help you. Don't ask this question, how can I help you? You have to start the conversation in another way, like you can ask, what seems to be the problem with you? What brings you to the hospital? What happened to you today? So these are the few questions you can start the conversation in this way. Please never ever ask how can I help you. So you have asked an open-ended question and patient has presented to you with chest pain or the tummy pain. Patient will start saying, doctor, I came here because I started having a chest pain 4 hours back. This pain is radiating to my shoulder and this pain is going toward my tummy and I have some vomiting as well. But you have to keep the Socrates in your mind and you have to ask all the question from the Socrates. So when patient will tell you 2, 3 or 4 things out of the Socrates in this way, then you will again ask an open-ended question. Please tell me more about it. Patient has told you about the pain. Now you are asking, please tell me more about it. And then a patient will start telling you, doctor, it started suddenly, I was doing this, it is aggravated by this and it is relieved by this. When I bend forward, my pain relieves, and patient will give you the history. Now you are focusing in your mind on the Socrates. So patient will miss 1 or 2 things from the Socrates, and now you have to be vigilant that now you will ask. Like if patient has missed about the aggravating factor, you will ask about the aggravating factor. Please tell me, is there anything that makes the pain worse, anything that makes the pain better? And after this, please ask about the score of the pain, because patient will not tell you about the score. You will ask about the score of the pain from your patient, then your patient will tell you about the score. Now you have done with the Socrates, and for example, if patient presented with cough, now you will ask about the Oedipara. So after asking about the Oedipara and after asking about the Socrates, what you will do? You will ask, is there anything else? Patient will say, fever, doctor. Then you will ask, please tell me more about your fever. When patient will tell you everything about the fever, then you will ask, is there anything else? Patient will say, cough, doctor. Then you will ask, please tell me more about your cough. After this, you will ask, is there anything else? Please keep on asking, is there anything else, until patient says, no, doctor. So you have done the presenting complaint and you have asked about the associated symptoms of the presenting complaint in a way like asking, is there anything else? Now what you will do? So you have asked about the presenting complaint, that was the chest pain or the tummy pain, and you have asked about the associated symptoms. Now patient is concerned about something special, so you have to ask about the patient concerns at this point. Before going into the DDs, you have to ask about the patient concern. So how you will ask? You can ask, what are you concerned about more today? So in this way you can ask about the concern of the patient. So if you are following this template, this will also complete your ICE as well. So patient will tell you, doctor, I'm concerned about heart attack because there is a chest pain. So now you can see that patient is more concerned about the heart attack. Definitely you will keep this point in your mind while you will be discussing the management. You will discuss about this heart attack as well. Although if patient is having some pain in the chest due to trauma, but patient is concerned about the heart attack, definitely in the management you will also deal this concern of the patient as well. So after asking about the concern, then we will move toward the DDs. What happened? Like in most of the cases, in 99% of the cases, after asking the history of the presenting complaint, it will lead toward the diagnosis. But what happened? Please ask 2 or 3 DDs in this type of scenario as well. Never ever try to ask like 5, 6, 7, 8, 10 DDs, just 2 or 3 DDs. If you are not getting the diagnosis after asking the presenting complaint, then you can ask the DDs until you reach the diagnosis. But if you are on the diagnosis after asking about the presenting complaint, then what you will do? You will ask just 2 or 3 DDs, no more. Like patient is presented with chest pain, you have asked about the Socrates, and now you will ask, like patient came after the trauma to the chest. So how you will ask about the DDs? So you have to ask about the DDs. First of all, you have to ask most lethal DDs. Like if patient presented with chest pain after the trauma, you will ask about the heart attack. Do you think that your pain is going toward your arm? Patient will say, no, doctor. Do you think that this pain is associated with extreme sweating? Patient will say, no, doctor. 2 questions are more than enough for DDs. So then you can ask about the other DD. Do you think that your pain is relieved by bending forward? No, doctor. Another DD is excluded. So in this way you have excluded the 2 DDs. Okay, if you want to ask, you can also ask some other question as well. So after excluding the DD, so if you think that you are not getting the question in your mind of the DDs, you can simply ask about the flaws. FLAWS. F mean fever. You can ask about the lethargy, you can ask about the loss of appetite, and you can ask about the weight loss and sweating. So if you are not getting any question in your mind, you are forgetting the question of DDs, you can simply ask about the flaws. Flaws also include almost all of the questions of the DDs. So after asking about the DDs, what we will do? We will move toward the P2. So first thing was the P1. In the P1, you have to ask about the presenting complaint, associated complaints, and you have to ask about the concern, and you have to ask about the what? You have to ask about the DDs. In the P1, you have to ask 4 things. After P1, we will move toward the P2. In the P2, you have to ask 2 things. Like any previous history of similar complaints, like patient presented with chest pain, you will ask, do you have similar type of pain in the past? This is one question of the P2. And the second question is, any previous medical condition? Are you diagnosed with any long-term medical condition in the past, like hypertension, like diabetes mellitus, like stroke, cholesterol, and thyroid problem? Please ask these 5 questions while you are asking about any past medical condition. So after doing the P2, we will move toward the P3. And please keep in mind, P3 is all about lifestyle. And lifestyle questions, if you are forgetting the lifestyle questions, simply ask DESA, DESA, plus minus sexual history and IV drug abuse. That's it. This is P3. So DESA again, like diet question, diet, exercise, smoking and alcohol. If there is some case that is leading toward the importance of sexual history, then you have to ask about the history as well. If there is some case that is leading toward the IV drug abuse, you can ask the questions of the IV drug abuse as well. As I mentioned that P3 is all about lifestyle. So before asking these questions, you have to signpost to your patient. Like you can ask, Mr. Jones, I am going to ask you some questions regarding your lifestyle. Some of the questions may sound intrusive to you, but please be assured these are the part of our consultation. May I proceed? So please always signpost, because sometimes if you will directly ask about the sexual history patient, it can offend your patient. So please always signpost when you are going to ask about the P3, that is lifestyle. So there is some question like if some patient presented with acute chest pain, would you like to ask about the diet and exercise in this situation? No, never ever try to ask about the diet and exercise in the acute emergency situations. Alright, but you will ask about the smoking and alcohol. Okay, and if some patient is presented with discharge from the front passage, so definitely you have to ask about sexual history and smoking and alcohol. No need for the diet and exercise in this situation as well. Okay, so after P1, 4 thing in the P1, in the P2, 2 things, in the P3 there were the 3 things, and now we will move toward the MAFTOSA. So please keep in mind MAFTOSA, like M means any previous medication you are taking, any allergies, any family history of the similar problem. Okay, and after this you will ask about the any travel history or any contact history. Then you will ask about the social history. So social history is very important in some situations. I will discuss shortly. So after this you will ask about the anything else. Okay, so let's suppose if some patient is presenting with a chronic condition, like if some patient is diabetic, uncontrolled diabetes for 20 years, definitely you will ask about the social history and occupational history. So how you will ask about the social history? You can ask, whom do you live with? Are the things okay at your home? And at the same time occupational histories as well. Okay, and one thing more that is very important, if you are taking history and patient is presenting with chronic condition like some patient is having hypertension and diabetes for 20 years. So after asking the initial presenting complaint, you will take the social history and occupational history on the upper side. So you will not wait of asking about the social history and occupational history at the end, because if some patient is having the chronic condition, definitely chronic condition affect the patient occupation and the social life. So chronic conditions affect both of these things like occupation and social life. So you will ask about the social life and the occupation in the chronic diseases right after the presenting complaint. So this is just the shifting of the things. So after asking about the MAFTOSA, you will end the conversation asking anything else apart from this. This is A of MAFTOSA. So in the P1 you have asked about the 4 things. Number 1 is the presenting complaint. Number 2 is the associated symptoms. Number 3 was what? Number 3 was the patient concerns. And number 4 was the DDs. So in the P2 you ask about the two things. Number 1, past history of the similar condition and past history of any medical condition. In the P3 you ask about the 3 things. Number 1 was the lifestyle, that was DESA. Number 2 was the sexual history, and number 3 was the IV drug abuse. Okay, so then in the MAFTOSA we ask about the MAFTOSA. So after completing the history, so what we will do? Definitely we have to take eyes along with the history. Like in the start we ask about the concerns of the patient, and now before ending the history we will ask about the expectations of the patient. Do you have any expectations from today's consultation? So this is a way you will start the history and you will end the history. And please keep in mind, you have to complete this history in 4 minutes. So this is the reason in medical cases which are purely history based, where you have to make the diagnosis, history can take a little bit more time. So this is up to you, that you have to practice well and you have to complete your history in maximum 4 minutes. What happened to the people, because they are taking the history up to 6 minutes and they are giving just 2 minutes in the management, and when results came, they say, oh, I just got 1 mark in the management. Oh doctor, you were giving 5-6 minutes to the history and you were giving just 2 minutes to management. So this is the reason you got very low marks in the management and you got failed. So this is the approach. You have to take the history. In the other videos, definitely I will discuss how to take history in a counseling station, how to take a history in the test result station. So please keep watching the videos. Thank you very much.